centered around a really important program, which is the PACE program, the program for all-inclusive care for the elderly. And to help us better understand that, we have Ron Hess today, who is gonna walk us through the who, what, where, how about PACE programs. Ron, really excited to have. Oh boy, well, look at me. I look kind of funny here. Let me fix my background there. That's kind of interesting. Okay. The Ron, great to have you today. Really excited to dive into the PACE program. And folks, in a moment, you're going to understand why this is such an important program for us to know about. But before we do that, Ron, tell us a little bit about your background and the program that you're a part of.
Absolutely. And Steve, it's a pleasure to be here with everyone today. My name's Ron Hess. I presently serve as the executive director for a program called Cherry Blossom PACE. I have about 10 years of tenure working in PACE spaces across the nation, predominantly here on the East Coast, but also some experience in California and some consultative work that was done in between. So a lot of time spent in PACE space is actually upon my undergraduate. Happened upon a PACE opportunity, wasn't very familiar with the concept, very quickly fell in love with the program and have never looked back since.
Excellent. All right, we're going to dive in deep, and your breadth of experience is amazing. The Cherry Blossom PACE program that you're a part of uh, primarily has people in the Northern Virginia area. And But folks, don't worry. I have put together a complete list of all the PACE programs nationwide, and I'm dropping that into chat, and we can talk a little bit about that. But so broad definition, Ron, for folks to understand, like what is what is the PACE program?
Sure. And in a nutshell, really, PACE is a complete healthcare solution for older adults that want to stay living in their own homes instead of an institutionalized setting, instead of any other type of a setting that would take them away from the places where they have built their memories, their families, and the community. And their upbringing. So the objective of the program really is to provide wraparound medical, home services, even transportation in one coordinated package delivered by a team that is incredibly familiar with each individual as part of that program.
Okay, great. And I've got a couple of slides that you shared with me in advance to this that the program was conceptualized in 1970s. I didn't realize it had that long of a history.
Yes, it has. And what's interesting about the inception of the PACE program is it was brought about in San Francisco in the 1970s. It was predominantly built out of a group of multi of migrants who had come into this area and had aged in place. And as the community kind of saw the rise in the Asian population, there needed to be a response or a solution for how the aging population would be cared for. So the community came together, and of course, as was the understanding at that time, predominantly nursing facility care was the preferred intervention. The community banded together and said that doesn't align with where we would see ourselves. And our loved ones. So the community kind of came together and decided that a community-based system was needed in order to keep our aging loved ones in their own homes and to provide the necessary supports and resources to make that happen.
Excellent. And then, as we had said earlier, this is a nationwide program. Currently, 33 states provide PACE programs. There's over 180 programs, which I think is growing, programs in development. Um, Now, this is kind of cool, the stat here. on average, PACE costs states about 12% less than other Medicaid services. Um, we're going to dive into their requirements and stuff, but could you share with us any insights on how this is delivering so much more efficiently?
I would say the easy answer there is that it's a single location, a single intercollaborative team that is instrumental in facilitating all of the care, whether that in PACE operates across really four domains. Um, it is the medical care for an individual. So their specialty, their comorbidities, their diagnoses, their medications. Then it also factors in the physical care of the individual. So how do they function in their environment? What are the challenges faced by being able to complete basic tasks throughout the day? To be able to get up, to be able to serve one's self breakfast, to be able to access groceries, all of those things comprehensively within that physical benefit. Then there's the emotional and the social needs of all of the beneficiaries. And those go without saying. The concept was constructed out of the need to build a community in San Francisco. And so that concept of maintaining a community environment it's built into the fabric of a PACE program.
Okay, great. Okay, now pace may not be for everybody. Okay, so let's talk about who pace is for, and then we'll kind of move into the experience of what it's like uh being a part of this program. So I've got a slide up on the screen that talks about eligibility and enrollment. You want to walk us through kind of how do we know whether PACE is for us or not?
Absolutely. So really just four general basic criteria for consideration in a PACE program. The first, you have to at least be 55 years of age or older. So that one's simple. The second, you must reside within a service area that is covered by a PACE program. And so I know you have a resource that you'll be providing to the group relative to PACE availability throughout the nation, constantly expanding year over year. We're seeing more programs that are being added. The third, you have to meet the state's requirement for medical eligibility. Now, that one becomes a little bit more nuanced because each state is a little bit different in how they apply that standard. But essentially, that looks like someone who has a level of challenges with conducting basic day-to-day tasks. There is some level of supervision or prompting or assistance that is needed to do some of the things that some of us kind of tend to take for granted in our day to day. Being able to get up and get around, being able to care for oneself independently, remembering to take medications, all of those are considerations in that medical eligibility. And then finally, and this one is really part of the complexities in evaluation and the assessment criteria for PACE is the ability to be safely served in the community. So individuals who will not be capable of being discharged from a long-term care SNF bed, for example, may not meet that safety criteria because a discharge may inherently put them into a high-risk category. But each of those is on a case-by-case basis and is evaluated by the PACE program at the point of enrollment.
Got it. Now let's kind of what I love, you've got a breadth of experience from all over the country in this area, but I love maybe focusing on your program specifically and which is Cherry Blossom Pace. Give us a glimpse of kind of what a service area is and what the program is like. So I've got your website up here, and I think that somewhere on here it sort of shows the region that you serve. Oh, here we go. Okay. So your program and folks, I went and visited the Cherry Blossom Pace location in Northern Virginia. It's absolutely spectacular. I mean, it is a beautiful modern facility and um so many engaged individuals there. It just blew my mind. But the as you'd mentioned, the service area here is that you have specific zip codes on your website that you serve. And I imagine one of the main reasons for those specific zip codes is you actually provide transportation to to your center, correct?
That is correct. That is correct. So Cherry Blossom Pace serves currently the Alexandria, Fairfax, and Arlington counties here in Northern Virginia. And so to your point, yes, in the state of Virginia, territories are granted to PACE programs based on zip codes. So it's very specific to zip codes with which people reside. Transportation is 100% covered, as is home care and all sorts of different services that we'll jump into in a little bit of depth here momentarily.
Okay, good, good. Now all right. Now, one of the things, and I think I see a question coming in related to Medicaid, okay, is that that was not one of the four elements. Like one of the Medicaid broadly, I look at as a program that takes care of the impoverished. For the most part, unless you're married, uh, you're you're on the lower end of the income and wealth scale. Um, so tell us a little bit about the role Medicaid plays in the PACE program, and can people participate in the PACE program that aren't on Medicaid?
Absolutely. And again, a very nuanced conversation here. So I'll give kind of some general ideas of kind of cost and how Medicaid is factored into this, and then talk a little bit more specifically. So in general, predominantly, I think it's about 95-ish% of PACE recipients or participants across the nation are generally enrolled into a Medicaid benefit. But to your point earlier, that is not an eligibility criteria. Generally, when an individual comes in and they have Medicaid, full Medicaid coverage within the state, typically there's not a cost of care to that individual. So that Medicaid benefit ultimately covers the cost of care. Nuance, a ton of nuance there, and very different state by state and how that might look. Here in Northern Virginia, long-term Medicaid is, as opposed to community Medicaid, is what is utilized for the PACE benefit. So if an individual does come in under long-term Medicaid, under the, I think it's a 1550-ish income threshold, that individual, there's no cost to the care that they receive. Individuals don't have to have Medicaid. They can come in through a Medicare benefit, or they can come in and not have eligibility for either of those programs. And there is essentially a monthly, I described it as like a subscription fee. That's probably not a great way of defining it, but
Membership,
essentially,
maybe. Yeah.
yeah, there's a fixed monthly cost that when that cost has been met, there is no additional cost beyond that. There's no copays, no deductibles, nothing beyond those particular that particular premium, I suppose, is the best way of identifying that.
All right. I love it. Okay. So now, let's see. Let me make sure that I'm addressing any questions that have come in. So Anne says, I'm not fully conversant with the upcoming Medicaid cuts. The question is, how do you anticipate the impact of these Medicaid cuts on PACE? And is it currently funded with Medicaid waivers? You answered that question. It's long-term Medicaid, and then some Medicare. Okay. But do you actually, we had Howard Gleckman on our program talking about the cuts, and he feels that from what he's seen is that Pace seems to be pretty isolated from the potential cuts.
That's correct. And just a quick aside, the conversation with Mr. Gleckman was phenomenal. I geeked out. It was a fantastic conversation and very, very insightful. But to that point, that is correct. PACE is not anticipated at this moment in time to have a major impact as a result of some of the Medicaid cuts experienced throughout the nation. There will be repercussions, and particularly to communities that may not have access to the same or similar levels of services unaffiliated with PACE within their individual communities. However, we're not anticipating that there is a risk of PACE's operation that would be a consequence of those cuts.
Okay, great. And I want to walk through sort of the experience from start to finish. You qualify, you apply, and then now you're a participant. I want to walk through that with you. But before we do, let's address some of these questions coming in. Mamela says, "Is this program in an assisted living facility? And what is the cost?" And Mamela, uh, there may be a PACE program somewhere in the nation that's in an assisted living, but the one that Ron is involved with, they have their own location, their own site. But Ron, you want to talk a little bit about that?
Absolutely. And I think it's important to talk about what PACE is and what PACE is not, because there's common misconceptions that come along when talking about PACE. So what PACE is not, it is not a nursing home. It is not an urgent care, a hospital, an emergency room, or a home care staffing agency. Frequently asked, but those are not things that by the definition of PACE are necessarily what it is defined by. All of those services, however, may be part of that benefit of the PACE program, but by itself, it is not any one of those individual pieces. It is, however, a health plan and it is a health provider combo, meaning that care coordination, care provision, so hands-on care, PCP type care is provided, and care coverage. So the actual cost or the payment for specialty care, medications, home care, transportation is a covered benefit within the PACE program. It is a fail-safe, it is a safety network for seniors. It is a community that's born out of human connection. It's designed to adapt to the changing needs of older adults as we continue to age. But it is not an adult a day program only. There's a common misconception that PACE is simply an adult day service. And while that is one of the branches of care that's facilitated through PACE, generally in PACE, attendance is not a requirement within the adult day program, but it is offered and on a case by case basis. Some folks will come to our program once a week, 5 times a week, and some folks may not come and leverage the adult day program on its own. They may, enjoy the other benefits that are offered through the PACE services.
Okay, great, great. And okay. And then let's see, Wally says within medical criteria, are there specific diagnoses that are included or excluded, such as dementia? So yeah, tell us a little bit about that.
Sure. So broadly, it's going to be different state by state. So each state is going to have its own condition by which it evaluates medical criteria. Here in Virginia, there is a state-driven algorithm that really it evaluates the medical conditions. I can't say with finality that there is one particular condition or diagnosis that makes someone that helps to make someone more eligible than another. But what I can say is anything that is impactful on someone's ability to function independently in the community is impactful on that medical criteria.
Okay, great. And we're getting a bunch of more questions, but I love these, and I hope you like them too, Ron. And then we'll go through a few, and then I want to kind of walk through the experience of a participant. Sandy says, "Is there a specific site where we can access information on income thresholds, whether single or married? Interested in learning more about costs, if not qualifying as a dual eligible."
So I think that the DMAS, the Department of Medical Assistance Services here in Virginia, is the best resource to when it comes to specific questions around income and eligibility. What I would encourage is the PACE here in Cherry Blossom PACE in particular. Our enrollment team works tirelessly with individuals who are interested in learning more, in getting more information, or becoming enrolled in our program, and will provide resources and work through a Medicaid application if that's the pathway that is of interest, and make sure that we are helping to facilitate every step of the path. One thing that PACE is very passionate about is growing older is not easy, and access into a lot of senior care resources is not easy. We we seek to act as an entity that helps to make that process more manageable, more digestible. We want to fill in all of the gaps.
Yeah, I agree. So folks, if you're in Northern Virginia or you're in California, reach out to the PACE program because they've had so many people go through the process. They can guide you before you kind of go down a rabbit hole that may be extra work for yourself. Let's see. Janine says, where can I find pricing on vendor payments? In other words, what you pay your vendors. Okay, well, this is a good. I'm assuming Janine might be sort of a vendor out there, but tell us the role. Do you use outside vendors, and or is it all self-contained?
Sure. So it is a contracted network of service providers that is constantly expanding day by day. And so vendor payments and specific to the vendors that are utilized is going to be, again, very specific on a case by case basis with each program. But generally, it will have a comprehensive package of all of the needed specialists. Ranging from cardiology, nephrology, emergency care, all of those will be a required contract that will be part of the PACE network.
All right. Great questions as always, y'all. Okay, Francis says, if you enroll in a PACE program, would you give up your existing primary care provider and specialists such as neurologists and cardiologists?
That is a question that comes up very, very frequently. So recent CMS regulation changes have made it such that a PACE program is capable of contracting with a primary care provider's office to allow continuity of care for individuals who enroll into the program. PACE is meant to be the facilitator of care. So it is meant to be the entity that helps to schedule, coordinate all appointments to make sure that if there are recommendations made by a specialist that they are followed through. So as a primary care individual comes into our network, we are capable of maintaining that continuity so long as they're agreeable to contract with the PACE entity and ensure that there is consistency when someone enrolls.
Man, all right. Okay, and Dixie says, I love the PACE wraparound services. Can you explain your end of life care with hospice as a Medicare benefit?
Sure, sure. So PACE sees care through the end of life, and so PACE benefit, of course, is conflicting with a hospice benefit. So one could not enroll collectively into both PACE and a hospice benefit simultaneously. It's double dipping in the eyes of the state and CMS. And so instead, what PACE can do, and here at Cherry Blossom, what we will do is we will provide extensive palliative care. We work very closely with end of life practitioners, and we are able to contract for kind of an a la carte type hospice benefit and have that provided directly to our participants.
I love it. Okay. Let's see here. We've got some comments from Audrey, who piloted a PACE program in New York for intellectual disabilities, and it proved successful. Lou says, I'm from Delaware, and I'm looking to build capacity for a PACE program. Where should I start? What would be your recommendation for Lou?
The National PACE Association has excellent resources, and particularly for those who are interested in starting up PACE programs. It provides a lot of benefits, it provides a lot of resources, and a lot of knowledge around state and federal regulations that would apply, deadlines, all of the things that one would need to be successful in opening up a PACE program.
Yeah, and here is the National Pace website. I'm going to drop that into chat for everybody, but it is a great resource, and it's also a really easy way uh, to find where all the Pace programs are. I've also put together a little article here that lists all the Pace programs. As you can see, there's over 188 around the country. So good luck with that in Delaware. And I'm assuming, Ron, with your experience, you probably talk to folks all over the country and can also give folks guidance if they're if they're looking to start a program.
Absolutely, and I'm happy to do so. I'll be sure to drop my email address in the chat. And for those who are listening
Okay,
in, it'll be ronald.hess@cherryblossompace.com. Happy to help.
I love it. Okay, let's see. Some good. Okay, so let's see. Last question. I promise I'll get back to the questions, but let's answer this one, and then I'm going to have you walk through the experience. So Audrey says, have you partnered with rural health clinics or FQHCs? I don't know what an FQHC is.
Federally Qualified Health Center, I believe.
Oh,
Um,
okay, good.
And yes, there is partnerships with FQHCs and rural hospital programs. And in fact, where I think PACE has thrived, not so much here in Northern Virginia, it's a little less applicable, but I do serve on the Virginia PACE Alliance board, and there are a number of PACE programs further south of us that serve rural territories. PACE is excellent in being able to help with individuals in rural settings, to be able to connect with those hospital settings and to be able to make sure that we are orchestrating all of the different elements of care and doing so effectively.
Okay, great. And I dropped in a definition of FQHCs for everybody there. Okay, so we'll get back to the questions, but Ron, take me through the experience. So let's say that, I've got a client or a neighbor or my mom or dad, they meet the categories. What walk me through how I can figure out A, if is peace going to be a good resource for them, and then what I need to do to get them enrolled in PACE.
Sure. So generally, when we are posing the question of kind of what is the next step, or is there challenges in is it safe for mom or for my neighbor or for someone that I am close to continue to operate with the absence of resources, then that's the time to start to get PACE involved. I on the drive to work, and I've shared with some of my peers, you can't spell proactive without PACE, because that is the objective of this program. It is to be as proactive in care as possible so that we can reduce unnecessary visits to the hospital. We can reduce the falls. We can reduce the negative health outcomes as a result of unmanaged diagnoses. So PACE is meant to be very, very proactive in care to reduce all of the negative outcomes. If you were interested in learning more about the PACE program, there's several resources. There are, in each of the states, generally, there is a PACE Alliance that offers resources specific to that state. Here in the state of Virginia, that is the Virginia PACE Alliance. There is the National PACE Association that we referenced earlier that provides an abundance of resources for individuals seeking care, individuals who are seeking to be part of the PACE network, and those who are the PACE operators. So an abundance of resources. And then finally, reach out to your local PACE program. So I mentioned we're here in Alexandria, Fairfax, and Arlington in Northern Virginia. Reach out to Cherry Blossom PACE just to inquire, to ask the specific questions. Are you able to manage this diagnosis? How would it look like to get to this appointment if this is how the setup looks? All of those things. We like to be kind of hand in hand in figuring out these situations collectively and collaboratively.
Okay, all right. So let's say I've done that, and I'm going to use Prairie Blossom Pace as an example. I've got my mom, and she's within your zip codes, and I reach out, and uh, we decide that it's a good match. That so what is the first step?
First step, contact to our intake and enrollment department. From there, we will work collectively on a Medicaid application. We will work collectively on the necessary paperwork to get someone kind of further along that process. We start assessing immediately. So we have individuals from our program go out, and these would be the folks that this person would come in and be working with on day one of enrollment. So our occupational therapist makes a visit out to the home and evaluates home safety and security. The remainder of our intercollaborative team will set dates here at the PACE Center to meet with interested candidates so that we can explain more about our individual roles. There's 11 different disciplines that make up our collaborative team. So there's a lot of different care and a lot of different perspectives that are assessed and evaluated. And then prior to enrollment, a comprehensive care package will be put together and will be discussed with families to make sure that we are all aligned. And then starting day one, we will take on the care responsibility, all of the facilitation, make sure the medications are squared away, transportation to all appointments are squared away, all of it collaboratively.
Okay. I heard you mention 11 different disciplines. Is that this chart here?
Yes, it is. And this helps to give some insight of all the different areas of care that PACE touches into. One of the challenges, my heart goes out to anyone who has to go out and market a PACE program because it is such a comprehensive benefit that it's impossible really to articulate all of the different services that could be part of that package. But I think this infographic kind of gives some insight about all of the different roles that are part of the decision-making process and part of the care provision and part of the care planning process for every beneficiary that enrolls into a PACE program.
Okay, so the just because you've got these 11 doesn't mean that everyone or all of your participants are utilizing all 11, but their resources there. Um,
Correct.
One that kind of uh, popped out at me is home care coordinator.
Mhm.
So I know that during the hours of like your center is open, the actual center where people can come is like 9 to 5, or what are the hours of your center?
8 o'clock to 4:30, Monday through
Eight
Friday.
o'clock to 4:30, and people are coming to the center. But tell me, that I'm curious about the role of home care coordinator. I imagine that is for folks that aren't when they're not in the center. But share with me what that is all about.
Sure. So part of that initial assessment package is evaluating what are the needs in the home. What are the things that we can provide here at the PACE Center, and what are the things that we have to provide in the home setting? Home care is one of the kind of forefront considerations when coming into the PACE program. So home care can be anything from general kind of housekeeping and upkeep tasks, maintenance of clear pathways, could be assistance with activities of daily living, could be assistance with, making meals, with preparing, getting someone up and helping to do some exercise or helping to get someone kind of active throughout the day. In certain occasions, there's companionship that may be a part of that particular package. So everything is, to your point earlier, Steve, it's very individualized and specialized for the unique needs because no single person's needs are the same as anyone else. It is very specific to the individual needs of the individual that comes into this program. So the hours for home care in particular are not necessarily 8 to 4:30 Monday through Friday. They can be any number of different hours. It's entirely dependent on what the needs of that person are.
Okay, great. And let's see. The the other thing that you've mentioned it several times is the driver and transportation. Uh I mean, is that limited to just picking my mom up from her home and bringing her to the center, or is that more expansive in that potentially she could get a ride from her home to a doctor's appointment?
Yes. So by rule of thumb, transportation to and from the PACE Center, transportation to and from all medical appointments is well within the comprehensive benefit of the PACE program. In addition to that, the PACE team, that collaborative team that we saw a moment ago, they will make decisions about any other authorized locations where, using mom as the example, where mom might need to go. So here in Cherry Blossom Pace, we've had participants that we've needed to take to the bank because it's been challenging to get checks for rent. Those different things we are able to facilitate on a case by case basis.
Okay, great. Couple of questions that I see coming through are related to, is there a PACE program in Washington, DC? And there is, it's called Edenbridge PACE, and but it looks like they're not accepting applications at this point. Does that happen with some of these programs?
There's certain kind of extenuating circumstances I think that would limit enrollment for a certain period. I have every anticipation that DC in particular will be opening that back up when the time is right.
Yeah, yeah, okay, great, great. Um, and then Melissa says, who is the best person to contact if you're a provider? Okay, so for example, Melissa is with a Handy Pro. They're a home modification and accessibility organization. And so if you're a provider like that, that might benefit the PACE members by making their home more accessible, what's the best way to outreach? And do you have partnerships like that?
We do, and to that comment earlier about a constantly adapting and evolving contracted network with a PACE program, we are the thing that makes PACE work is being innovative in providing out of the box thinking when we are approaching care models. There is no one size fits all for senior healthcare, and I think that is just a testament to this particular field. We have to be creative and we have to think about care differently. So partners that do come with unique solutions and strategies, we are always interested in learning about how we can partner and how we can bring additional value to the lives of our participants. The best point of contact here at Cherry Blossom Pace is likely actually going to be myself. So I would strongly encourage to reach out to our main phone number, and I would love to be in touch.
And don't worry, folks, we're gonna have Ron's all of his contact available. It'll be on the recording link, but it will I just dropped it into chat as well. Paulette asks, will these slides be shared? Yes, I'll put those on the proaging.com link under recordings, along with every resource, all the chat that you see there, so you don't necessarily have to take notes. So that'll be there as well. Let's see. Hilda says, I'm wondering if you're familiar with Longevity Ready Maryland. One of its objectives is to facilitate proactive in-home aging. I think there's an opportunity. Now, Ron's program is in Virginia, but Hilda, I'm familiar with Longevity Ready Maryland and initiatives like that. Trust me, they love the PACE program. You know, because it's more efficiently providing care to folks. But any thoughts, Ron, on initiatives like Longevity Ready Maryland?
I love when states take proactive approaches on how to address the complexities of older adult and the aging population. Collaboration with PACE programs typically is not on the forefront of the minds of a lot of our different states. And so we love to kind of go out there and make sure that we are part of those conversations so that there's awareness of this benefit and how it can kind of interface with the different resources that are available for seniors.
Okay, cool. All right. Well, here's somebody that's got a question. Yeah, we're gonna jump back to my mom applying, and the question says, how long would you say the process is to join? How long would you say it to get services? So let's say that today I inquire, uh, what does the timeline look like for getting enrolled in the program and delivering services?
Sure. Since it is a health plan, at minimum, it has to occur on the first of the month. So there has to be a seamless transition from a previous health plan into a PACE benefit. So depending on the timing that someone might demonstrate interest, that may fall into the following month. But it is the month following the enrollment agreement being signed by the beneficiary themselves. I would say on average for us here in Cherry Blossom Pace, we are looking at about a 30 to 45-day window for enrollment. Typically, the piece that is the most telling for that is whether or not someone has already gone through the Medicaid, the long-term Medicaid eligibility process. If they have not, then typically that process might be the thing that takes a little bit longer to go through the appropriate channels.
Okay. And then so I've applied. we're going through the process, and now mom has been accepted, and the bus comes and picks her up on day one and brings her to your center. What does that experience look like during that day? And also if I'm missing anything in between that process there.
Sure. So a typical, again, everything's super highly customized on a case by case basis, but a typical experience for a PACE participant might be kind of waking up, having the home care aide come and assist getting up and out of bed, getting dressed for the day, maybe assistance with some showering tasks, preparing a meal, getting someone ready to get onto the vehicle and actually come into the PACE program. When they arrive, they'd be greeted at the door by our wonderful receptionist, and then there would be opportunity for them to socialize with peers. Here at the center, the recreational therapist has activities that are put together to make sure that there is engagement, to make sure that these are meaningful activities that help to drive a sense of community and being able to emphasize social interactions. There may be opportunities while that participant is here to work with their physical therapist on some physical therapy for functional mobility. They may have some questions they'd like to pose to the primary care provider about their medication, so that may be instituted into their day. They will have lunch around mealtime, and then have additional opportunities to get up and dance here at Cherry Blossom Pace. We do more partying, I think, than we don't, and so we have avid dancers. The participants have definitely taught me a number of moves that I didn't think I could even make my body do. But there would likely be a lot of laughter. There would likely be a ton of dancing, some music before that participant is sent back home via the PACE transportation at the end of the day.
Okay, great. And then folks, just if you're in Northern Virginia, we're going to have a networking event at this location in November, on November 11th. And don't worry, I'll have all that info the uh, on our website, and I can make sure that that's all set up when I put the recording up today. But let me share with you some visuals that might help you better understand what the center looks like here at Cherry Blossom Pace. There's the reception desk that, as we had talked about, we've got some outdoor spaces. Uh, it's a very modern, beautiful. I don't want to call it a facility location. It's very, and as you can see, tables for socializing. Um, and I believe I saw a screen. It looks like you've got some rehab equipment here. Is that a part of many people's programs, is going through rehab as well?
Yes, so we are equipped with a full therapy gym, a full clinic, and then on a full adult day program. So coming on site, this I think of the PACE Center as really just the central hub of resources that people can engage in here, and then there's opportunity for us to be able to mobilize all of those resources out into the community as necessary as well. But definitely an abundance of resources that are just maintained under this roof.
Okay, all right. Let me jump back to some of the questions. I've got a question here. It says, you help with finding shelter for those who may not have a place to live. So, do you ever get questions like that coming in through your intake line?
I think we do, and much more experience working through this during my time in California. Typically, what a PACE program will do, the expertise for physically securing housing of that individual may not be orchestrated directly through the PACE program. But what PACE is, it's instituted and it's got feelers out in the community for a number of community resources we're constantly partnering with, and so PACE may be able to direct someone into the appropriate direction of where they could seek that assistance and that help.
Okay, great. And then let's see, you provide other options for those who may not want to join, but cannot, who may want to join, but cannot keep their stipend payments.
So the stipends, I think we're talking predominantly through some of the HMO stipends, through some of the Medicare Advantage plans. Um, there's been a lot of different ways, and that's come up as a common concern in PACE spaces. And I would say PACE is actively working towards different strategies and solutions. What I ask for folks who do have that concern about losing the stipend is to consider what are the out-of-pocket expenses that they may occur that may be covered through a PACE program: incontinence supplies, home care hours, transportation, if we had to use Uber or Lyft to get to our appointments. Those are all costs that generally will vast quite a large amount month over month. And so sometimes there's a matter of weighing the pros and the cons of that decision. But PACE is also looking for different strategic options for how it can put together something comparable.
Okay, great. All right. Let's see. We've got some more questions here. Mona says, how do we know if there is a PACE in your state? Okay, Mona, I've got a list of the programs that I've dropped into chat. I'll do it again. Check that out. But Ron, as somebody who's sort of a pioneer in the space, let's say somebody does a search and they don't see a PACE near them, or like actually, let's use Virginia as an example. Let's say that I'm in Loudoun County, Virginia, and there's not a PACE there. Is there something that I can do to sort of promote or precipitate a PACE program in my community?
Absolutely, a number of different resources. I tend to point to the National PACE Association because it does have a lot of legislative power and support to advocate for communities that would like to be served by a PACE program. And then there's always the option to reach out to your local your local House and Senate representatives. There is a lot of power behind sending letters and behind making sure that the community's needs are verbalized.
Okay, great. Okay, let's see. Anne says, can folks currently living in a skilled nursing home with long-term Medicaid enroll in a PACE so that they can move back out into the community?
Absolutely. One of our recent success stories, really through the program, we had an individual who came to us who was long-term care that did not feel like the care that was being provided was in line with where he sought to have his care experience. So he had made the decision that he wanted to discharge. He worked with us here at PACE. He was someone who had a G-tube, who was wheelchair bound, who knew that there would be a lot of obstacles in going back home. But PACE, in its wraparound care and in filling in all of the care gaps, was able to come forth and was able to help him to discharge back into the community, was able to provide those services, particularly the therapies, to get this person back up, ambulating. He is now capable of walking almost entirely independently. The G-tube has been removed. One of our best success stories. So I would say long-term care admission on its own does not necessarily make someone disqualified for PACE.
Okay, but now in that situation, uh, I assume that that recipient had left the skilled nursing center to move in with the family, and then PACE was activated, correct?
I believe, if I'm recalling correctly, this individual noted that he wanted to be discharged, and in order to facilitate a safe discharge into the community, PACE had to come forward and say, as of the first of the month, we will be involved in care and we will help to institute that safe discharge plan.
Okay.
So,
Now,
kind of
could
concurrent.
there, and I'm assuming there could not be a situation where an individual would be in a skilled nursing center as a Medicaid recipient and then also enroll in a PACE program where you guys were picking them up and they were leaving the nursing center and coming to your site. I just want to double check that because that may be a question that comes in.
I would say, and that's a very nuanced question, because at the point of enrollment, I could see that becoming a safety concern. If one could not discharge him safely into the community, that may
Mhm.
not be. And again, state by state, that will differ. But in the state of Virginia, that would not necessarily make someone qualified medically. However, someone can age into a skilled nursing facility from their home in a PACE program because we follow through end of life. So we have individuals who are long-term
Hmm.
care recipients that we are orchestrating care back and forth with that nursing facility. So it's not impossible.
Wow. Okay, great. Okay, let's see. Question that I saw, several questions actually. Let's shift to Medicare. Okay. Please talk about eligibility for Medicare recipients. Lenore brings that up. And is there any particular services that would not be included if somebody was enrolled using Medicare?
I don't believe there would be any services that someone coming in through a different payer source would enjoy versus another. When one person is a PACE beneficiary, they enjoy the totality of access to care. Um, However, as far as what Medicare covers versus what Medicaid covers, Medicare will cover a portion of the that monthly premium cost, whereas the long-term Medicaid in Virginia will generally cover the entire cost of care. So there may still be, for a Medicare beneficiary, a cost associated. But to that point earlier, when that monthly cost is met, there is no cost beyond that. There is no additional fees incurred.
Okay. And I know your program is unique to Virginia, and every state could be different with Medicare, but you have, is there sort of a rough idea of a Medicare, somebody that qualifies for Medicare, how much their out of pocket would be to participate in a PACE program? This would be the person that is Medicare but doesn't qualify for Medicaid.
It would be dependent on the specific benefits that they are qualified for, if that's Part A, Part D, all of the different parts for Medicare. I don't have a dollar figure handy, but
Okay.
I can say that whether someone comes to us with partial Medicare coverage or doesn't have Medicare or Medicaid coverage, the general cost of PACE enrollment by and large throughout the nation is less than the cost of what it would otherwise be spent on for a long-term care nursing facility stay.
Yeah, and that's one of the main goals is to create a more efficient alternative to skilled nursing care enrollment.
Correct.
Okay, cool. Okay, Vic asks, is PACE for aging in place instead of moving to a life care community? And uh, I I wouldn't, based on my knowledge, I wouldn't say it's either or, but an individual that doesn't move to a life care community could benefit from this if they check the boxes.
Correct. I would concur. Individuals who want to remain living in their homes, wherever home is, really is the sweet spot for PACE. That's our objective, to keep them in their communities and to keep them connected.
Yeah, and in theory, I mean, a resident of a life care community could join a PACE program, but my knowledge of life care communities is with assisted living, nursing, memory care, and supportive services. That is probably not going to be an ideal candidate to join PACE. However, what I could see is a senior apartment building that doesn't have wraparound services. It's just independent senior living apartment building. How does that work? Is that do you have participants that live in those buildings that participate in your program?
Absolutely, absolutely. And that tends to be another kind of sweet spot for PACE to be able to come in and offer services. The areas where we have individuals who don't have direct access and aren't necessarily directly linked to community resources, that is where PACE is able to come in and fill those gaps.
Yeah, no, that makes a lot of sense. And I see, especially the lower income subsidized senior apartment buildings where folks need additional services, and there's not necessarily subsidized assisted living that's out there. You could see where this could be amazing for the residents of some of those apartment buildings. So that's a great service. Um, and that could also be a strategy that somebody implores is that I'm going to move to, or I'm going to apply to live in a senior living apartment building because I qualify for a subsidy. And if that apartment building is in the catchment area of a PACE program, now you've got extra services there that if you needed them.
Absolutely.
Um, Sandy asks, do you contract with pharmacies?
Another great question. So, PACE institutes, and I'll speak specifically to Cherry Blossom PACE because I'm sure that there could be other programs that approach this differently. But by and large, PACE institutes a closed pharmacy model. So we will be the individual, or we will be the entity that will physically send medications to a participant. We institute here at Cherry Blossom a direct delivery service to participant homes. We leverage kind of blister packs to be able to make sure that this is manageable, but we've also leveraged our ability to pick up medications via a contracted pharmacy network to be able to go out and pick up medications quickly for a participant. But we have to serve as the sole prescriber for the medication. So everything, and part of that package to make it easier for our seniors who are out in the communities with multiple specialists, multiple prescribers, multiple medication, having one single sole source that is going to be the entity that pulls all of that together to make sure that all of the docs are speaking the same language, to make sure that there's no conflicts in pharmacy or medications. That is where PACE kind of operates at, but it is through an internal or contracted pharmacy.
I love it. All right. I just glanced at the clock. We've been talking for an hour. We still have some questions to get through. You okay hanging on for a little bit longer? And is that
Absolutely.
okay, Ron? And then, folks, if you have to jump off, remember this is recorded. It'll be at proaging.com later this afternoon. All the chat, all the resources will be there, Ron's contact, what have you. Okay. Just got a question that I dropped into chat. It says, I have patients who often use the stipend to assist their caregivers they live with or that support them. How could they use PACE as a resource contrary to that benefit?
Another great question. So I would say for an individual who is using a stipend to assist their caregivers, generally PACE is likely going to fill in that caregiver that need, right? So the home care tasks that might be that I'm assuming this individual may be kind of paying for using that stipend would then fall into the PACE benefit. The stipend, if it was used for grocery support or just simply to do activities or things in the community, those are all resources then that PACE would come in and be able to provide as part of the collective benefit.
Great. Okay, Francis says, by any chance, does PACE provide access to aging life care managers, geriatric care managers, something that goes beyond immediate medical case management, focuses on helping patients and their families put in place things like financial medical proxies, making a range of end of life plans. And as Francis says, these are all things that we seem to talk about at every discussion. So I'm glad you brought that up, Francis.
Absolutely. And I've listened into some of the podcasts with some of the aging care management, and it's been a really, really exciting conversation. I would say PACE is tasked with being the care facilitator and the care manager. However, I don't think it's uncommon. I don't think it would be unheard of for programs to work with aging life care management so that there is an additional level of resource that is available to participants to guide them in a lot of those different practices. The financial documents and the POA paperwork and all of those different things are typically things that PACE has been able to facilitate, but there's always benefit in having additional kind of subject matter experts involved in that case.
Okay, cool. And I feel like we got through all the questions, but before we were chatting, uh, as I'd mentioned to you folks, solo aging seems to be the most popular topic on our platform. And Ron, you said that you had some thoughts to kind of share on how your program supports these folks that are on the solo aging journey.
Absolutely. So solo aging is such a profound concept because to a point you've made on an earlier podcast, we're all aging. We're all aging at the same rate, and that process looks different to each person. Every body is different. Where PACE comes in to make that practice a little bit more practical is we provide the community and the resources to make it to make it so that there is one single entity that solo ager has to interface with instead of the hundreds or thousands of other resources that they might have to interface with on a day in and day out basis. So I think PACE is able to fill in a need and to provide the resources to make solo aging a little bit more manageable for individuals. And we have a number of PACE participants who come to us that are solo agers, and we are able to make sure that we are impactful in their care.
Yeah. And folks, if you're tuning into this and you haven't listened to some of our solo aging discussions, they're all online at proaging.com. But also, just a reminder, the definition of solo aging, it varies by the individual. I mean, it doesn't necessarily mean that it could be a person that doesn't have a partner and doesn't have family, but it could be somebody that is basically estranged or separated from their family. Or, what many of the people that attend our solo aging discussions have a spouse with dementia, and they truly feel like they are alone. Okay, Lenore asks, what happens if you're hospitalized? So let's say my mom's part of your program, and I call up, it's like, mom can't come to the program today because she had a fall last night and she's hospitalized. How does PACE play that role?
PACE follows care irrespective of setting. So if someone were to go to the emergency department or to the hospital, and sometimes if we have cases where there is an urgent need, we may send individuals from the PACE center to the hospital. Um, but we will continue to follow care. We will continue to have conversations between our clinicians and our providers and the hospital clinicians and providers to make sure that there is a mutual understanding that we are able to provide resources and information about diagnoses and treatments and all of those things so that it is a comprehensive benefit,
Holy
really, at
cow.
the end of the day.
And I tell you what, folks, I mean, all of us, none of us have a crystal ball, no matter who we are. If I entered the hospital today, I need somebody advocating for me. And what a huge benefit to be a part of this program. And in the event, and hopefully none of us, it happens, but you land in the hospital, now you've got an advocate, somebody that can advocate for you in the PACE program. That's amazing. Great question, Lenore. I wouldn't have thought to ask that question either.
And PACE
Okay.
also institutes after hours on call emergency services. So here in Cherry Blossom, we have a nursing line that's available. So if someone's even just not sure, do I take myself to the ED, the hospital? It's after hours. I can't go to the PACE center and ask the question. We have a nurse that's ready for them that's able to provide guidance.
Holy cow, Ron. I'm blown away. I mean, I've had discussions about pace, but you've articulated it really well. And but really what I'm blown away at is that you even had an hour of time to spend with us to explain this, because all the different things that your program does, and you and the leadership position there, it's pretty monumental.
We will always find
Um,
time to make sure that there is the ability to spread PACE awareness in the community. That's our number one effort.
I love it. So, folks, this has been a great discussion today. Thanks for your time. Thanks for all the questions that you had. If you're in Northern Virginia and you want to check this program out, you can do it anytime just by contacting Ron. But if you want a really fun experience, come on November 11th, when we'll have a bunch of senior living providers and public that are together there, and checking out the PACE program, and we're going to line up some good speakers as well. So uh any last things that you haven't shared that you'd like to share?
It costs nothing to reach out. Please feel free, send questions. We're happy to help in any way that we can. And I'll speak on behalf of really all the other PACE programs across the nation. I'll take that liberty that all of us we're here to help.
I love it. All right, folks. Well, this has been a great addition to my day, I know, and hope everybody has a great day. I'll get this recording up with the contact info, and feel free to reach out to Ron and his colleagues all over the country. All right. Thanks a lot, Ron, and we'll see you in November.
Thank you all.
You bet.